Welcome, beloved students. In the chapter of inflammation, we are starting our second lecture. As we have discussed cellular events in acute inflammation, margination, rolling adhesion, pigmenting diabetes, chemotaxis. Now the next one is phagocytosis. Phagocytosis done by neutrophil. Phagocytosis done by monocytes or macrophage. Or eosinophil. Eosinophil can also do phagocytosis in case of parasite, and this was one of the most important MCQ type question. Now the steps of phagocytosis. The steps of phagocytosis. The first step is recognition and attachment. Recognition and attachment. For example, this is macrophage. How will it recognize a body? How will it recognize a body which will be phagocytosed by this macrophage? So simply, for example, this is a molecule produced by what? Produced by a foreign body like bacteria. The molecule surrounded from this bacteria is opsonin. Opsonins are surrounded here. These opsonins present on the bacteria help in recognition and enhances phagocytosis. Got it? Example, antibody like IgG or IgM or complement C3b. This is one of the most important function of the complement. I mean opsonin, antibody and complement. Through these three molecules, macrophage recognize the body and attach to that body. Now, when macrophage recognize, for example, macrophage recognize this. Now this macrophage will attach to this body. Now on macrophage, there is a receptor present called scavenger receptor. We have discussed in chapter number 1. Scavenger receptor. And through this scavenger receptors, it attaches to this body, whether an endogenous body or exogenous body. This macrophage attached to this body, like in this case IgG, for example, to the Fc fragment of C3b, Fc fragment of IgG or C3b. So this is recognition and attachment. Simply recognition is done by opsonin, antibody or complement, while the attachment is done by scavenger receptor. Now the next step is engulfment. How will it engulf? So this is macrophage. When it recognizes and attached to the body, inside the macrophage, calcium level increase. When calcium is increased, GTP is increased, and GTP done what is the function of GTP? Simply polymerization of the contractile protein called actin. So contraction of the cytoplasm developed, and there is a formation of foot-like processes which is called pseudopod formation. And now inside the macrophage is lysosome. It engulfs this body. By this pseudopod formation. It engulfs the body. Now it engulfs the body, which is called phagosome, because when this body is surrounded by a double layer, it becomes phagosome. Now when this macrophage engulfs this phagosome, this macrophage will take this phagosome towards lysosome, and we will call it phagolysosome. Phagolysosome. What we will call? Phagolysosome. The first step is recognition by opsonin, antibody or complement. The second step is by attachment by scavenger receptor. The engulfment is done by the contractile protein like formation of the pseudophore, and then phagosome is taken towards lysosome, and the third step is killing and destruction. The third step is killing and destruction. So killing and destruction, how will it kill or destruct? Now inside the lysosome, granules, the bodies like granules are present. These granules will rupture, which is called respiratory burst, respiratory burst. In these granules, when burst, it will release an enzyme that is called NADPH oxidase, or respiratory burst oxidase, or phagocytosis, which is controlled by FOX gene. Three name mentioned here: NADPH oxidase, respiratory burst oxidase, phagocytosis. This enzyme will produce free radical and it will kill the bacteria. So simply four steps actually: recognition by opsonine antibody or complement, attachment by scavenger receptor, engulfment due to increase in calcium leads to pseudophore formation. The third step is killing by NADPH oxidase, which will produce a free radical and that is harmful to the foreign body or endogenous body. Now after killing, acid hydrolase in lysosome, it will degrade this bacilli. For example, we have discussed, let's suppose, a bacteria. So acid hydrolase in lysosome, that will degrade this bacilli. Now let's discuss some important about phagocyte. Now let's discuss phagocyte killing. This is oxygen dependent and oxygen independent. Oxygen dependent is done by NADPH oxidase, most effective method. Oxygen forms superoxide. Superoxide, then by superoxide dismutase is converted into peroxide. Peroxide is a free radical but weak. Then by myeloperoxidase or chloride ion, this peroxide convert to hypochlorite, which is most effective for phagocyte killing. So this whole system is called hydrogen peroxide myeloperoxidase halide system, while oxygen independent killing is done by lactoferrin lysozyme, not lysosome, lysozyme, and major basic protein in case of eosinophil. Let's discuss a pathological case, for example, a case of medicine with this topic. There is a disease called chronic granulomatous disease. In the chronic granulomatous disease, the etiology is respiratory burst enzyme is mutated. Respiratory burst of mutation in the FOX gene, and this may be membranous or cytoplasmic. Membranous is X-linked recessive, cytoplasmic is autosomal recessive. Simply, when FOX gene is mutated, it leads to chronic granulomatous disease. FOX gene may be membranous, may be cytoplasmic. When there is a mutation in a membranous, it is X-linked recessive. When there is a mutation in the cytoplasmic FOX gene, autosomal recessive. Genes responsible here are GP, glycoprotein 91 FOX gene mutation, and here P47 and P67 FOX gene mutation. So in chronic granulomatous disease, when there is no respiratory burst oxidase, there will be recurrent infection with catalase positive organism to the who is defective. Catalase positive organisms we have covered in the microbiology portion. The examples are Candida and Staphylococci. This catalase positive organism will degrade hydrogen peroxide. Why it will degrade hydrogen peroxide? Because hydrogen peroxide is not going converted to hypochlorite, which is most effective. Got it? So there is a formation of the granuloma, and this is we can also call primary immunodeficiency. Simply, if I summarize this whole topic in a one line, when there is a mutation in the respiratory burst oxidase or FOX gene, it will lead to chronic granulomatous disease. You can download the PDF of this lecture or contact me. I will provide the notes in colorful version. I have mentioned my contact number in the first comment. Have a blessing day.